My name is Kristen Toussaint, and I'm an occupational therapist, and I specialize in pelvic health therapy. Pelvic floor therapy is therapy specifically related to dysfunctions of the pelvis. So we look at the pelvic floor, surrounding structures, and we help to improve symptoms. Pelvic floor therapy can be used to treat incontinence. That can be either bladder or fecal incontinence. It can be used to treat constipation. It can be used to treat urinary retention. It can be used to treat chronic pelvic pains. That can be tailbone, pubic symphysis, low back or hip pains. It can treat pelvic organ prolapse, and it can treat pain during sexual function. So good candidates for pelvic floor therapy would include the pregnant and postpartum population, people who have or who are in a perimenopausal or postmenopausal state, people who have had pelvic organ prolapse, people with pelvic cancers, and people with chronic pelvic pain. So the first visit of pelvic floor therapy is always going to be an initial evaluation. We're going to look to see what your symptoms are. I'm going to talk to you, kind of figure out where your symptoms are impacting your everyday life, and we'll kind of figure out what might be causing them. So we'll do a muscle strength assessment, behavioral assessment, figure out what your diets are, your habits are, and then we'll work to develop a individualized plan. Therapy is usually about once a week for anywhere from 4 to 12 weeks, and we work towards strengthening or managing any muscle tension that you might have. We'll have home exercise programs and some changes to your behavior or diets that might be impacting your symptoms. The goals of pelvic floor therapy are to eliminate symptoms. So if you are incontinence, it is to rebuild continence, to get you in control of your bowel and bladder. If it's pain, it's to eliminate pain. If you are having prolapse symptoms of heaviness, it's to manage those symptoms so that you're not having discomfort throughout your day. I enjoy working with pelvic floor patients because a lot of times people who have symptoms that would benefit from pelvic floor therapy are really impacted in their daily lives. Incontinence can prevent people from leaving the home or being embarrassed about their current situation. And I think being a provider who can help you improve that area of your life is a big piece in quality of life for a lot of my people that I work with. I think our team of therapists here at the University of Maryland Outpatient Rehab Institute are a very collaborative group of therapists. So our physical therapists, occupational therapists, and speech therapists work very closely together, and they communicate and help to treat patients in a very holistic and well-rounded way to get the most improvements of symptoms possible. I want to encourage everybody that if you are having symptoms, whether that be chronic pain, constipation, incontinence, or pain with intercourse, please reach out to your providers, communicate these concerns so that you can get help. Please do not be embarrassed about your symptoms or be afraid to talk about them when you're talking with your providers, and ask for the assistance, because there are things that can be done and in a non-invasive way to help improve your quality of life.